Hi, I'm Dr. Shark with Shark Holistic Health, and this is part of our findings series. I want to talk about brain stuff today. So the two major findings you might see in the brain category most commonly are brain inflammation and neural fatigue. And these two things are related. First, brain inflammation, just what it sounds like. There's inflammation around the brain, and the way that this typically shows up is in poor cognitive function, right? And so we'll see brain fog, slow processing, difficulty recalling, difficulty comprehending, reading comprehension or directions. And the extreme, you see real confusion where you may look at something that you should be able to do, like a set of directions, and you simply can't make sense of them, like almost no processing at all. So that's what we see in brain inflammation. The causes of brain inflammation are inflammatory processes in the body, right? So that can be autoimmunity, which creates a lot of inflammation in the body, which isn't supposed to cross into the brain, but under certain conditions will. That can be just general inflammation in the body for other reasons, multiple injuries that haven't healed for whatever reason, ongoing stress on the body, such as overexercise, things like that. Or the most common cause that we see of brain inflammation is toxicity. So if you haven't watched the liver and toxicity one, that's kind of an underlying cause. When the toxicity builds up to a certain level, it starts to kind of deposit in our fatty tissue. And one big place we have fatty tissue is around the brain and around the nerves. And so this toxicity, your body will kind of tuck it there to keep it metabolically inactive. So not floating around in your blood, making you acutely ill. However, it does interfere with your neurological function when the toxins are tucked into your white matter around the nerves and in your brain. And so when there's a lot of toxicity there, we start seeing inflammation. Your brain will inflame to try to kind of cleanse itself. But the brain works a little bit differently than the other kinds of the parts of the body when it's inflaming and de-inflaming. Your brain, actually, when you look at the cells there, the majority of the cells in your brain are glial cells, which are the inflammatory cells. So they're in there to try to burn up any pathogens or anything that might get into your brain and threaten your life. But they don't really have a good off switch. So once these guys get going, they start flaring up and flaming, and they don't really turn off easily until that cell dies out and a new one gets made. But if the cause of the inflammation is still going on at that point, that one's going to flame up. And so then you have this kind of ongoing brain on fire situation. If the brain inflammation situation goes on for a while, or if you have actual brain injury, so damage to part of the brain, you can get something called neural fatigue. So under normal circumstances, the more you practice something, the more a neuron fires in a particular path, the better it becomes at doing it, right? So you think about playing an instrument or even running, right? As you do it, or exercising, as you do it, it becomes easier because you create really smooth neural pathways for that activity. With neural fatigue, the opposite happens. The more you work a pathway, the more it wears out and the worse it functions. And so the most common way that people will experience this is that they have some period of the day where it seems like their brain can work. They're able to function, they're able to do things, and then at some point, it's like there's this powering down situation that happens in the brain where the brain just turns off, right? And it's very important to note that when you're in neural fatigue, when that's already happened, your brain has powered down, there is nothing to be done in that moment to restart the brain other than rest. You must rest the brain at that moment until it resets. So people want to know how long. Until it resets. If you have a lot of inflammation and a lot of neural fatigue, that could be till the next day. Right? If it's getting better, it's not too bad. Maybe it's a 20-minute break, right? You'll know because if you're still really having to force your brain to think, it hasn't reset yet. The goal with neural fatigue is to 1, rest and reset, 2, prevent neural fatigue. Stop before you hit the shutdown, and then reduce the brain inflammation so that you're not operating under so much stress.